Hello everyone, my name is Dr Cadet, infectious disease specialist. Today I'm here to talk to you about what to do when your loved one is in the hospital. Number one, you need to understand your role as an advocate. Now, keep in mind that being an advocate means that you have to speak up for your loved one and you have to know your loved one's rights, needs, and preferences in a medical environment. uh, it's very important that you understand what's going on as an advocate. You have to help ensure proper care and treatment so that there will be a reduction of the likelihood of medical errors. My brother was recently in the hospital for a whole month and he ended up passing away there. And there was a lot going on. There were a lot of miscommunications, um, some errors, and it's really important that you're aware what to do. So you need to collect your loved one medical information, understand what medical problems that they have, any allergies, and know what their wishes are. Very important to do that. It's always important to understand the in-life decision, in-life care, and any religious and cultural belief that your loved one may have. So you need to designate a primary contact person for the medical team to streamline the communication. And something else to do is there needs to be effective communication. Now, with effective communication, you're going to be dealing with a lot of professionals and family as well. So you have to build relationship, introduce yourself to the team, let them know who you are, and express your role in supporting your loved one. And you need to ask questions. Do not hesitate to ask about the diagnosis, about the treatment options, about the side effects. A lot of times family members, they get intimidated. They don't want to speak up. It's very important that you do that for your loved one. I had to do that as a physician for my brother. And it's important to ask what are the benefits and the risk of each treatment options, and take good notes. Yeah, it's important to document the conversation with the healthcare providers for later reference. Really important to do that. And another thing you need to understand is your right. Understand that you have right, your loved one has right. You have right to information, where you have right to understand the medical condition and treatment options. You have right to consent. Patients need to give informed consent before any treatment. You also have right to privacy. So when you give information, there's what is called HIPAA regulation, and your rights are protected by that institution. So really important to know that you have multiple rights. Another concept to understand is how to navigate the healthcare system. Now, understand that the hospital, the clinics, they all have the policies, and it's important to understand the policies regarding visitations, procedures, and the rights. So it's important to involve your loved one whenever possible and in all the discussions. And if there's pushback and if they are imposing certain policies on you, you can ask, how do I go about saying those policies? Can you introduce them to me? Can you share those with me? Another concept is the coordination of care. It's really important that care in the hospital is coordinated with a multidisciplinary team. And you have to be aware that may involve lots of specialists, sometimes physical therapy, and other areas. So it's really important to follow up with the appointments, discuss post-hospital care, and including rehab and some other appointments. Another concept is how to handle conflicts and concerns. It's really important to identify the issues. You need to recognize when something appears off regarding your loved one. A lot of times the loved ones are in the hospital, like my brother personally, he was in the hospital. There were things that were not being done, like turning him, and also his arms were swollen. There was no venous Doppler done. So when that happens, you talk to the physician involved. If it's the intensivist, you talk to the doctor in charge. And if that's not being resolved, you ask to speak with the supervisor. And also understand there's emotional support for your loved one. And it's really important to understand that those are times of high stress and sometimes discouragement. So there needs to be great communication, effective communication. Help your loved one to express their feelings, their fears, and also communicate that with the medical team. And sometimes they have social workers, they have case managers. All of those disciplines can actually help you with what you're going through. Okay? A very important concept to understand is the concept of self-care for the advocate. Now, it's really important to know how to manage stress for the loved one and stress for yourself. So you have to being an advocate now can require a lot. So you have to take breaks. I would recommend that you form a team that will be around 24/7, so that better care can take place and the chance of errors can be minimized in the hospital. So, in conclusion, ladies and gentlemen, advocating for your loved one is not easy. It requires vigilance, effective communication, and lots of compassion. And a lot of providers these days, they don't have that. And I experienced that firsthand with my brother being in the hospital for a whole month, and he ended up passing away. Some of it because of his condition, but some of it because of neglect from the hospital staff, which is the reason why I'm asking you, I'm imploring you to form a team so you can be the eyes and ears for your loved one when he or she is in the hospital. Well, I hope that was helpful. If you like this video, please click like and share it. And I wish you the best. Blessings to you all. But I hope that the video was very helpful to you. Thank you very much. Peace.